Coughing is a natural reflex action, but when the cough persists, it calls for concern, and the need to get quick medical help is necessary. Sometimes we react spontaneously in public to people who cough around us, not because of pity, but because everyone is conscious of contagious diseases that may be contacted through the air, and one of such is the deadly cough, tuberculosis. That's the topic we shall be discussing in today's episode. We have in the studio Dr. Uju Ozo, a pulmonologist at the College of Medicine, University of Lagos, an expert who will speak on tuberculosis. I am Edak Willie. Stay with us. We'll be right back. Welcome back. Thank you for staying with us. Dr. Ozo is going to educate us on tuberculosis today. Welcome to our program.
Well, my pleasure.
Please, what is tuberculosis?
Tuberculosis is an infection caused by a bacteria, but it's a different kind of bacteria in that it causes a long-term chronic infection. And surprisingly, tuberculosis doesn't just affect the lungs. It affects every organ system in the body, but most times the lungs are involved. That's why people think that everybody that has tuberculosis must have a cough. Okay. But you can have TB in any organ, but it's a bacterial infection, a different kind of bacteria that causes a long-term infection.
So how is it transmitted? It's
transmitted by when somebody is exposed to somebody who has tuberculosis of the lungs and is coughing. So it's what we call is an aerosolized infection. It's transmitted by droplets that are produced when somebody coughs and releases the droplets into the air and somebody else inhales them. It will also amaze you that one cough releases about 3,000 bacilli from one cough, and you can imagine a lot more when a person sneezes, and this goes into the atmosphere, and somebody close by can inhale and become infected. However, every infection does not mean disease. I can tell you that 50% of us are infected by tuberculosis, which means we've been exposed and our body has mounted an immune response that keeps it in check. However, later in life, we can, depending on what happens to your immunity, as you will know that people with HIV and some infections are more prone to tuberculosis. That is because they have been exposed, and at a time when your immunity drops, then the disease can manifest. So it's important to note that infection does not equal disease, because 50% of us are infected.
Okay, you say it's caused by coughing. So when one coughs...
It's transmitted by coughing.
Transmitted by coughing. Should one that is infected coughs in this room now and leaves, another person comes into this room, can the person be infected?
Yes, it depends on the environmental air. Where in this room is closed, is tight, so the bacilli can linger in this room up to 9 to 12 hours. Okay, but that's why we encourage ventilated spaces, particularly cross-ventilated spaces that have windows on either side so that air can flow across. In such conditions, transmission is reduced. Okay. Also, when we talk about contact and contact to somebody who is coughing, we should also bear in mind that it's not just one-time contact. We talk about close, prolonged contact.
Okay. How long does it stay in the body before it manifests as a sickness?
It depends, like many things.
Okay.
It depends.
Yeah.
Some people at the time of initial exposure can have their immunity can be so low that initial infection leads to disease.
Okay.
Some other people, that initial infection stays quiet. They mount an immunity that is enough to control the infection until a later time in life. While some people who get infected will never manifest the disease all through their lives.
So it depends on the immunity of
the person. It also depends on the quantum of exposure, such that if you're living with somebody in a room, like a household contact for a long period, if the quantum of exposure is so much, then it overwhelms even a strong immunity.
Okay. Some people say that it can be hereditary. Please explain.
Oh, no.
It's not?
No. No. TB is an infection, and you get the infection later in life. A child who is born to a mother that is coughing can develop the infection after birth. But nobody is born and with TB. No, that's that is not hereditary. It doesn't run in families. You see it in those clusters because they are exposed to the same environment.
Okay, so what necessary prevention should one take?
The prevention, one, is to avoid close contact with people who are coughing.
How would you know?
Well, they're coughing.
Just that cough, no.
Well, prolonged cough. If you have a colleague at work, for instance, who has a cough, and the cough is lingering for a period of, we say when a cough is longer than 2 weeks, 3 weeks, then you should screen for tuberculosis.
Okay.
So it's not just an acute cough. We talk about a chronic cough. The other things that are often associated with the cough, sometimes they can have a fever, weight loss. Somebody is coughing and is losing weight. That should make you suspect that the person has TB. Another way we can prevent TB is by keeping our environment ventilated. You know, these days we're all happy to have cars, have drivers, and have air conditioners. And we're sharing an environment with a person whom you don't know where he's coming from for hours in a day. So that has led to transmission in places you don't expect. I've come across people who are shocked that they have TB, but at the end of the day, it ends up being somebody you brought into your home, a driver, a maid looking after your kids, spends long hours with your kids, and at the end of the day, you wonder how do the kids come by. So our environment is very important. Cross-ventilation. We should, in offices, it's nice to have the air conditioners, but it's also good to have a means of ventilation. There are other ways of that in other climes where TB is really a problem. Okay, we have UV bulbs, special UV bulbs that can deactivate the bacilli when they are released. But those are often in clinics and in places where people who are known to have tuberculosis come to. So those are all the measures that can be taken.
Okay, please talk more on the symptoms of TB.
Okay.
Because most people do not know how to identify it.
Yes. Because I said most times the lungs are involved. So the commonest symptoms, cough, chronic cough. Often we talk about fever and night sweat. We talk about a drenching night sweat. A sweat that makes you want to take off your clothes at night and wear another one, and then it gets soaked again. So that's what we call a drenching night sweat. So fever and weight loss. People have significant weight loss when they have really active TB. So fever, cough, fever, weight loss, night sweat. Those are often the things you will ask that will make you to suspect. When the TB is in the lungs, remember it can affect any organ. It can affect the bone, it can affect the organs in the abdomen. So people have meningitis from TB.
Wow.
Yes, so it can cause any other symptom, any other manifestation, but because it's often in the lungs, we often talk about those symptoms. So in this environment, it's when people present with chronic illnesses, we often look.
Check for
TB is a suspicion because it's endemic, it's here with us.
How about like spitting blood?
Oh yes.
Part of it.
That is also part of it, coughing up blood, you know. And coughing not just blood, it could be brownish sputum, not just...
Okay. Is there any psychological effect on the patient?
Oh yes. You know, the psychological effect of TB is actually as a result of the perception people have of TB. Okay, people think TB is a death sentence. Once you have it, you're going to die. And then there's also stigma. So even people who have don't want anybody to know.
No.
So that affects the person who has TB. Studies have shown that there's a lot of depression and anxiety amongst people who have TB. One, they don't want anybody to know. Then they are losing weight. They don't look good. So all that affects the patients.
So have you come across a case of stigmatization?
Oh yes. Some offices have sacked their staff because they have TB.
Oh.
Yes.
But there's cure.
Yes, there's a cure, but they don't know. That's the challenge. That's the the importance of the program you're having so that people will know that having TB is not a death sentence. And yes, it can be transmitted. But the transmission, once someone starts treatment, the rate of transmission is reduced, and in a short while, the person is cured and can live a normal, complete life.
Let's take a break. When we come back, doctor will tell us whether it kills and at what stage. Stay with us. Welcome back. Doctor, please tell us, does TB kill?
Without treatment, TB is said to be uniformly fatal, which means if somebody is not treated, the person is likely to die from TB. Okay. But with treatment, there's a cure, and the person is completely and totally cured.
So how long does the treatment last?
Treatment lasts a minimum of 6 months, and the person has to take the drug daily for 6 months. And
daily?
Yes, daily for 6 months. And that is the challenge with the treatment of TB, because when people start the treatment, in a short while they feel better, and many people will stop the treatment. And that leads to relapse and the problems associated with spread of TB.
For the patients that are treated, are they kept in a different place?
Yes, initially, when they are still infective, which means when they are still coughing up the bacilli into the environment, it's important to separate them from the rest of the population.
For how long?
The interesting thing is that with treatment, most people become non-infectious in as short as 2 to 3 weeks with proper treatment. So if someone is coughing and the test shows that there are bacilli in the sputum, with effective treatment, in about 2 to 3 weeks, you won't find any bacilli anymore, which means they are no longer infectious.
Okay, so how expensive is this treatment?
That's where the government comes in, and that's the good thing about treatment of TB, is that the government has made treatment of TB free at the DOT centers. I'm sure in Lagos State there are over 25 or 20, almost every local government, every small community has a DOT center, where patients with TB can go and get treatment free, okay, under the DOTS program that is sponsored by many agencies, federal government, Bill Gates Foundation, and so on. TB is one treatment where you beg the patient to take his medications because you don't know who is coughing. You can't control the air. So it's important to the public, for public health purposes, that the patient who has TB takes his medication. So for that reason, the government provides free treatment for TB.
So can it be controlled? It's scary. What you are saying is quite scary. Can it ever be controlled?
Yes, the most useful tool in controlling TB is identifying and treating cases. So if you identify all those who have TB and treat them, there will be no more TB. So that's the challenge. Yeah. Okay, so that's the whole control program of TB, is aimed at early diagnosis and effective treatment. I've told you the challenge is taking medication for 6 months. Most people will not. So you need to get people to adhere to treatment, complete their treatment. So as you reduce the pool of people who are infected, then the transmission reduces.
I was thinking, should it not be compulsory for everybody to get tested?
Well, that comes to the new, you're bringing in something new. Because when we talk about treatment of latent TB, that is treating all those who are infected but who don't have disease. Because honestly, those who are infected are the reservoir of infection. Because when their immunity is altered, they can develop the disease. That is what WHO is proposing. That is what is being proposed all over the world, that latent TB, those who don't have the disease, should be identified and also treated, in addition to those who have active disease. But that takes a lot of resource to do, okay? And here is endemic with us. Who will you treat?
Doctor, can it be transmitted through objects?
Such as?
Spoons, plates, toothbrush?
Well, not really. It's a droplet infection. You need to inhale it. When we're talking about transmitted through spoons, that's if you don't wash the spoon. Okay, but the spoons we use in restaurants, everybody is sharing spoons that are just washed. that will not transmit TB.
If it's not properly washed?
Yes, because if it's not properly washed, you have saliva, sputum, that has the bacilli. The best that can happen is that the person swallows it.
Okay.
And yes, we know that swallowing some bacilli can give a different kind of TB. But when we talk about pulmonary TB, it's actually inhaled. So we're talking about droplets. So that's a small part of transmission. The main part of transmission is from people who are coughing, not from cups and spoons. Let's talk about coughing, reducing the aerosols that are being released in the environment.
So from what you're saying now, we have different kinds of tuberculosis. So you've talked about the pulmonary one. How about the others?
We have extrapulmonary TB that can affect any organ. Lymph nodes are the commonest organ involved, or commonest tissue involved.
Okay.
Yes, so most times the cervical lymph nodes, you see people with swollen lymph nodes in the neck. Also, you can have the joints, bones of the spine, and they have TB of the spine, what we call Pott's disease. Okay, can also, often you see people with a hunchback.
Is that
yes,
TB?
some of it is TB, some of it, not all, because what it does is that it causes collapse of those vertebrae, and that can give you the hunchback. That used to be common in the olden days when there was no treatment. But now you don't see a lot of hunchbacks anymore because there's effective treatment even for TB of the spine. It can affect lymph nodes anywhere in the abdomen. It can affect the lining of the stomach, of the abdomen. It can affect the brain, give you TB meningitis. It can affect even the brain itself.
If it affects the brain itself, how will it manifest?
The way meningitis will manifest, which is fever, headache, okay, they can have seizures, loss of consciousness. But unlike bacterial meningitis, which is the normal meningitis you know, in TB, the onset is slower. So the person has headache for a while, fever for a while. Eventually they they have altered consciousness, and then they may become unconscious. But the progress is often slower than that of typical bacterial meningitis, but it can cause
It's
meningitis.
quite deadly. Please, doctor, mention a few about, talk a little about the stomach wound. How does it manifest when it affects the stomach lining?
Abdominal pain, discomfort, swelling, because if it affects the stomach lining, often it leads to secretion of fluid into the stomach, which is what we call ascites. And if someone has ascites, the abdomen will be a little bit bigger.
Wow.
Okay, and really large amounts of fluid can actually accumulate there, and that is the way it can manifest in the abdomen.
So does it affect the liver, the kidneys?
It can affect, any organ can be affected.
It's quite deadly.
Well,
I'm scared.
there's treatment. That's the good thing.
Let's take a break, doctor. We'll be right back. Welcome back. If you are just joining us, we've been discussing tuberculosis with the doctor. Doctor, are health workers in danger?
Yes, we health workers are exposed to a lot of risk of contracting tuberculosis. I'm well aware of many doctors who have been infected and have even gone on to develop active disease from being exposed to their patients. And it's even worse in this environment. So not just doctors are at risk, patients who are nursed with TB patients are also at risk. That happens in some hospitals where patients are mixed up, well patients, TB patients, everybody is mixed in the same ward, and that is a real challenge, and that encourages the transmission of TB.
Really, the challenges are too numerous. What is the way forward?
Well, you can't manage TB without political will, okay? It requires political will, government commitment, and that is part of what the DOT program is actually all about. It addresses that because you need political will to have the medications available at the DOT centers all the time. You need political will to provide resources that will help in identifying and treating all the patients that have TB. You need resources also to educate people and provide facilities that are close to their homes where they can visit and get tested and treated when they have TB. Also, another way is public enlightenment. The public need to understand the symptoms, know where to go, and also understand that the disease is curable so that they can come forward and also get treated. Identifying and treating cases is the most important aspect of TB control. So that is the way forward. We need facilities, we need capacity to be able to identify and treat all patients that have TB so as to reduce
Yes, Doctor, give your final word to the public.
Well, my final word is that TB is curable, TB is treatable, not just manageable, like we talk about hypertension. The way people say, oh yes, I know it's manageable. This is curable. With treatment, the person is cured. You only need to come forward and get treatment. And without treatment, TB is uniformly fatal. Uniformly fatal. It means without treatment, the person will die. But if you have TB and you get good and appropriate treatment, the person will survive. Doctors have a good role to play in control of TB. Because also, part of the challenge is that many doctors don't know the right dose of medications, the right duration, yes, of medications. So even when patients see doctors, they don't give them the right treatment. So educating doctors is also an important aspect of TB control.
Dr. Ozo, thank you for coming.
It's my pleasure.
I really enjoyed this interaction.
Thank you.
Thank you for watching. We'll be right back. Stay tuned. Welcome back. This is the favorite part of the show, medicine from your kitchen. Today, we will talk about how to detoxify your liver. First, you should know that your liver does great functions in your body. Example, your blood flows through the liver. Also, the liver creates bile, that substance that helps in digestion. Because the liver takes in so much, it needs to be detoxified so that it can function more effectively. Here are tips that you can use. Prepare a smoothie with the following fruits and herbs. We have grapefruit and half of one grapefruit, 2 carrots washed and peeled, beetroot. I've already peeled mine, washed and peeled mine. This is what it looks like. Half of it, half of a lemon, and apple, half of it too. And we have green. You can use ugu, that's a pumpkin leaf. You can use spinach, any green that you like, any green vegetable that you like. And this is what I do for my smoothie. I've already cut all these items into my blender. Add 1 cup of water. So you add your green leaf, any green leaf of your choice. Then I blend. Let's see whether it's smooth. Yeah, smooth enough for me. This is how you prepare your liver detox smoothie. It's very tasty. This is how I do my own. A glass of it a day is enough for you. Just make it a part of your lifestyle. 3 months to 6 months, every day, you'll see how good you'll feel. Thank you for watching. That's my tip for you today. See you next time. My name is Edak.